My knowledge prior to having a miscarriage, I didn't really know about miscarriages other than my mom had shared with me that before me, she had a miscarriage.
Before I had my first miscarriage, I don't think I even knew anyone who had suffered a pregnancy loss at all.
I feel like I always heard that statistic, like 1 in 4, 25% of people experience miscarriage. And you kind of like know that's a big number. When I was going through it, I didn't really have anybody else to like turn to for it.
My name is Crystal and I've had a miscarriage. So when I found out about being pregnant with Sasha, I was excited, but then kind of like, just because I had an 8-month-old. And I went in on May 5th, and that's when they told me I was pregnant. I heard the heartbeat. The heartbeat was strong. I called my boyfriend. I was like, well, guess what? Surprise. But then that weekend, I felt as if life had just left out of me. When she came in, she was explaining to me, well, we don't have the heartbeat. And I was like, what do you mean? Like, what do you mean? You don't have the heartbeat? Like, it was just there. Like, that was hard. I did end up telling my daughter later on, and she's actually the one that gave her the name Sasha. Sasha means someone that was here for a little while.
My name is Rebecca, and I've had 3 pregnancy losses. Our first pregnancy loss was very early. The second one was pretty similar. The third pregnancy loss was at about 22 weeks, and that baby was stillborn, and that was because of placental abruption. I don't like to refer to him as the stillborn baby. We were going to name him Ryan. It's never just a miscarriage. It's never just a stillborn birth. You have lost a child. You have lost a future. You've lost the next 21 years or whatever of raising this child. It was overwhelming grief.
I'm Holly Brown, and I'm on the board of directors of Haven Miscarriage Clinic, and I've had 2 miscarriages. First loss happened before we had our first baby. I remember telling my husband, like something just doesn't feel right. I was starting to have some spotting. And so she had me come in for a PET HCG draw. And when I went in for that, they could tell that my levels were going down at that point. You've already started the miscarriage process, so we don't really need to see you at this point. I think what was going through my mind was like experiencing this loss and the like just deeply emotional piece of that, but then also like, is something wrong with us? We had started trying for our third baby. We ended up getting pregnant, but like something just doesn't feel right and I can't sleep. We showed up the next day and we sat in the waiting room, and I remember like shaking, and Jeremy was like, what is wrong? Like, it's gonna be okay. The screen that came up, I just like knew immediately. And she's like, I'm so sorry. There's no heartbeat. That's like your worst nightmare when you walk into an ultrasound, is hearing like those words. Like that's what you dread hearing. I don't even know how to process this right now. Like there is a dead child inside of me, and how am I supposed to even think? I think that's one of the hardest parts about a miscarriage is like, it's such a emotional experience. I mean, it is the loss of a child. And then on top of that, you're having to try and make decisions of what to do with your physical body too.
The provider that I saw initially offered us a resource for just a discussion group of women who had had pregnancy losses, and that was it. I don't know that I ever felt shame for having miscarriages, and I didn't purposely hide it. It's just not pleasant to talk about.
I did not get an explanation at all for my first one. It was just kind of like, try again.
They release you back out into the world as if nothing happened. And it's like, for me, I kept my ultrasound from when they first said, because I needed to know that she was real. She wasn't a figment of my imagination. Like I really actually went through that. She was actually here.
Do not suffer alone. Talk to somebody, reach out to somebody. Find, if you don't have really close support as far as family or really close friends, a close church group, find something. You've lost children. And it's grief. It's grief the same as losing a child that was born. Nobody should ever go through anything that mental, that massive alone.
I think having a specialty in miscarriage just changes the game. This is what you do. Like, it feels like, you know, when you go to like a midwife or an OB, it's like what they do is pregnancy or what they do is surgery. Miscarriage isn't on their like title, you know? Like, I think having a specialty place where people have that mindset of like very empathetic care, people who like know what you're going through and can help direct you in those really big decisions. I think that'll be a game changer.
My name is Melissa. I'm a perinatal mental health counselor, and I've had 2 miscarriages. After a loss, there's so many emotions that people can feel. I always say there's layers of loss.
The typical emotional impact of pregnancy loss is definitely grief. It's that feeling of longing for something that's no longer present. It's a feeling of sadness, sometimes feelings of guilt and shame. Some common symptoms and reactions. We're gonna go straight with the Kubler-Ross stages of grief, right? So we're gonna have sadness, we're gonna have anger, there'll be depression, there'll be bargaining of like, why is this happening? Or I would give this for that. And then we get to a space of acceptance. The grieving process is a non-linear journey. It's okay to go from anger to acceptance and back to sadness, because it truly is a process that you're learning to acclimate yourself with. It really is coming to terms with your new normal and being okay with that non-linear journey through grief.
There's a lot of barriers, but some of the main things I thought about were the shame and the silence that kind of comes with not having family to reach out or other people to talk about that loss with. There's some kind of messaging around when we talk about preventing miscarriage to women, we talk about the things that they can do to improve their lifestyle, improving their health. And so sometimes the first time that they have the loss, their first experience is, what have I done? Did I do something I shouldn't have? Was I not taking in the optimal amount of nutrients? And so that can be really hard. That self-blame can come in, and so it makes it hard for them to reach out.
There's a lot of misunderstanding about what miscarriage truly is. Oftentimes I see when people navigate through hard things, they want to find a place for the blame. And a lot of times women will take on that shame, that guilt, that blame, because they were the ones carrying the baby.
I really recommend that they reach out to a professional and get support right away. In the initial stages, there's a little bit of that shock, and they might be coping just fine, but at the same time, we know that there's a period of time after a crisis where we go into crisis mode, and we might feel energized. We might be thinking positively, thinking that we're ready to try again, ready to move on. So sometimes it might be hard to recognize some of the things that they're coping with. In the first year after a loss, there's some research that shows that miscarriage can quadruple a risk of suicide. And with therapy, some of that evidence is that someone can reduce their risk by about 25% if they're in some kind of talk therapy.
A lot of times people don't get referred to mental health support because they don't know who to refer to. So I think there's really an opportunity for therapists, especially therapists and clinicians who have perinatal mental health certifications and courses of study, to really show up and really get out in the community and advocate that there is a niche of mental health support for families who are navigating this side of grief, this side of loss, this side of postpartum, to really help rehabilitate them within their new normal.
I wish I hadn't waited so long to do therapy. That's where we can sit with someone and just let them be. All the feelings are welcome as they get to their own path to healing. I love the idea of having a clinic with those services readily available.
So Haven is creating a space that allows women who are navigating through early pregnancy loss a space to feel what they truly feel. Loss at any stage is difficult, but early loss is a very special space that needs to be managed with a different type of care. And I think Haven is going to open up the opportunity for families to receive that type of intentional care and love, so that they can have the space to heal and move forward through their loss and into their new normal. My name is Dr. Pingale Erica Choa, and I have suffered 2 losses. A miscarriage typically happens before 20 weeks, and what happens is the fetus doesn't develop properly, whether it's because of some chromosomal abnormality or a genetic abnormality. And so what happens is a woman suffers that loss, either presents itself through bleeding or abdominal pain, but they're unable to carry that pregnancy past 20 weeks. For some women, they may not have that diagnosis of a pregnancy established. For them, they haven't had that education surrounding miscarriage. They don't even know if they're pregnant really. And so they're coming to the emergency department, number one, to say, am I pregnant? Am I losing the baby? What's next? For those who have had an established pregnancy, so they've had an ultrasound outside of taking a home pregnancy test, so their provider has done a bedside ultrasound and shows that there is a baby and there's a heartbeat. At that point, they have something called a viable pregnancy. And so when they present to the emergency department with bleeding or abdominal pain, it could be 2 things. Number one, they just don't know. And so they just go straight to the emergency department because they have no idea. Number 2, I would say people are scared. Am I going to bleed to death? Is my pain normal? Is what's going on with my body? It's almost like this, I feel hopeless, and maybe there's something somebody can do in the emergency department. Even though I know my doctor told me that, you know, if I have bleeding or abdominal pain, to call her, and maybe that I'm gonna have a miscarriage and I can follow up. The emergency department is really tough when it comes to the way we handle miscarriages. And being on the other side now, I'm able to see 2 sides of the table. Prior to suffering a loss myself, I would have to say that I treated a miscarriage, you know, like I would treat other different ailments that come in through the emergency department. So there's the element of triage. Is this person dying? Is this person not dying, right? And if this person is dying, I'm bringing them in. We're doing all the things. If they're hemorrhaging, like bleeding, we're doing all the things. If they're not dying, or if their triage level is low, they're gonna sit in the waiting room, right? I'm not thinking about the emotional toll. I'm not thinking about the shame, the humiliation that comes with sitting in a waiting room. I'm not thinking in that way. I'm thinking about moving the meat. It's a lot of things that are going through the emergency physician's brain. It's about moving the meat. It's about taking care of the sickest patients. And so your perception of what somebody is going through, you may not feel or empathize with that. And so it becomes a really difficult place for people who are experiencing such a loss. We then discuss what they can do at this point. For some people, it's watching and waiting, which is what we call expectant management. And then for other people, it may look like, I need a little bit of help getting everything out. Maybe it's just a little spotting and I just don't want to go through this. And that may look in the form of medications. And for really rare cases where, you know, maybe expectant management doesn't work, or they may not want to take medications to help, and they want to be done with this, we do offer something called DNC, but it's not typical how we start unless there's some complication, like there's a lot of bleeding or there's infection. It's not always the first choice. Like a lot of other topics in women's health, it's almost like a taboo to talk about it. When I suffered my own miscarriage, I saw how hard it was to talk about that, because it's the perceived failure, right? I remember, you know, God bless her, but someone, you know, telling me, well, you probably drank too much coffee, or it's all the traveling you're doing, right? It almost puts the blame on the woman for that loss. And so I think that's probably the reason a lot of women don't talk about it. It's just because they're afraid that people will look at things that they're doing wrong, right? Their lifestyle, look at things that they did wrong and sort of put that blame. And so I think a lot of women don't speak on it because of that reason. That first miscarriage that I had was so impactful for my life. It was so impactful for my practice. It impacted how I parent my child right now. And so You have to get past the fact that this is not something that you did. And that process is not something that happens overnight. And then once you get pregnant again, imagine carrying a child and not enjoying that pregnancy because every minute you're thinking about losing your child. My experience with the healthcare system at that time helped me reflect on my experiences prior to having a miscarriage and how I treated other patients who were coming through, right? It's like, it's not just oh, you had a miscarriage and follow up with your doctor, here's some ibuprofen, right? Now it's like, I'm sorry, right? Like, I empathize with what you're going through. It doesn't matter that the loss is, this baby's 4 weeks or this baby's 6 weeks. That loss means a lot to her. And so I think the identification, that level of empathy, and just not being desensitized, because you see this all the time. Miscarriage, I'm seeing all the, it's you have to go beyond that and understand that even though this thing seems so minor to you, this is life-changing for someone. That would be the biggest thing in my experience, is that as clinicians, we have to have more empathy for what a woman is experiencing when she's having a miscarriage. But what a wonderful thing you're doing, because I think if I knew that there was a resource where I didn't have to go through this traumatic process, right? And there was an avenue where I can go and feel like a human, and someone can talk to me in a comfortable way, talk to me about my choices, refer me to the people who can help me. That would be a much better place than going into the ER and sitting for hours, bleeding and feeling like just what's going on with my body.
My name is Hannah, and I'm a certified nurse midwife. I've been a midwife for years and years. I've delivered hundreds of living babies and also walked with a lot of families through pregnancy loss from 4 weeks to 40 weeks. I've had a front row seat to the very cruelest reality of nature, which is that some babies just don't make it. And over the course of the years in managing these families and walking through this journey, I've developed a frustration over the lack of empathetic care and effective management that we offer. So pregnancy loss is the most common complication of pregnancy itself. 1 in 4 pregnancies end in loss. And even here in Atlanta alone, we see 25,000 miscarriages annually. With something of this magnitude, we just can't ignore giving great care. So you can either present to the emergency department or you can get managed through your OB/GYN office or your OB provider, both of which are fine, but they offer something a little bit different. You absolutely can go to your OB office. They're some of the most empathetic providers that I know, but the difference between that kind of care and the care that we're offering at Haven is assumption. To paint a really good picture of that, think about hospice care. Hospice notoriously is end of life care. That sets a different tone. It drives the type of employee that works there. You often have chapels and gardens and fountains because there's an assumption of loss. There's a sensitivity to the gravity of grief and the potential of lives being lost. And so the assumption at Haven Miscarriage Clinic is the assumption of loss. And that sets a different tone and a different lens through which we deliver care. At an OB/GYN office, there's a lot of different tones there. And one of those tones is happiness, right? Because the majority of babies do make it, and we do get to hold them in our arms. So it's very obvious by the atmosphere there. So we see lots of baby pictures on the wall. That's why you get your tote bags and your samples. It's a positive atmosphere, but that's not always the most helpful when it comes to pregnancy loss care. The other side is the emergency room. Now, 75% of miscarriage women go to the emergency room. That being said, only 0.5% of them are actually admitted, and complications are really rare.
Not to mention, the emergency room is not the most cost-effective option. So on average, women pay between $3,000 and $7,000 for their miscarriage care. When we are going through a pregnancy loss, our brain is actually changing in response to a traumatic stimuli. So there's a lot of things that happen. There's rewiring that happens. Our executive functioning is impaired. A lot of women experience like a brain fog around that time too. And unfortunately, the early stages of grieving coincides with when we're finding out about loss. And that's when, as providers, that's our expectation for them to be making decisions, which is really unfair to them. So there's a lot of mental health changes that happen, or brain changes that happen when we're grieving. Mental health significantly impacts women, and most women do not receive a referral to see a therapist or mental health practitioner. And unfortunately, pregnancy loss quadruples the rate of suicide within the first year following loss. It doubles the rate of depression. 1 in 5 women experience post-traumatic stress disorder, and it increases our risk of anxiety, both current and then also in subsequent pregnancies and throughout our life. There's a natural tendency towards isolation when we undergo a pregnancy loss. This drift has happened after years and years of shame and stigma and cultural perceptions of pregnancy loss. Some cultures believe that God's punishing a woman for her sins. Some cultures shun ladies, and I'd love to say that that's not the case, but this drift to isolate ourselves does still exist, and women need support immediately to walk them through that process. We have intentionally designed Haven Miscarriage Clinic to fill this gap in miscarriage care. We plan to provide medical services including ultrasound and lab work, offer genetic screening, follow-up. We are working hard to hopefully offer outpatient surgical management at some point as well. So we've partnered with a lot of other organizations to surround families who are undergoing loss. And then we also developed a mental health program. So every single patient or family who comes into our clinic will receive a free consultation from a therapist, because we so believe that early assessment is key in preventing mental illness in this population. As soon as the clinic came about, we had such an outpouring of love and support, and I truly believe so many people feel like this care is necessary. That being said, we also need funding to make this a reality. We set up the clinic as a nonprofit so that care could be affordable and accessible, and that we could use donations to help subsidize the costs so that everyone could receive this kind of care. Even the most marginalized in our community could receive this kind of care. So we need ambassadors. We need people that believe in us. We need donations. We need companies. We need corporations. We need providers. We need you to make this clinic a reality. Haven was designed to be a place of safety and a place that women can go to feel supported through their miscarriage experience. We want to humanize that experience for everyone. And it's not only a place, but it also was a person. It was a baby that I carried. And we want to keep that close to the heartbeat of the clinic, that this is a person for everyone else who's going through pregnancy loss.